Okay, we now discuss progestins and antiprogestins. Okay, basically progesterone, about the female sex hormone. We already discussed about estrogen. Now we move on to progesterone. Okay, again, the type of progesterone are natural and synthetic. Okay, natural and synthetic. Uh, Natural and synthetic. Natural is one, progesterone. That is our progesterone. And among synthetic, there are medroxyprogesterone acetate, MPA, medroxyprogesterone acetate. Okay, this is the main one. There are another one is hydroxyprogesterone caproate. Okay, and other are norgestrol, levonorgestrel, desogestrel. Okay, the important ones are, or the primary drugs are, medroxyprogesterone, norethindrone, and desogestrel. Okay, desogestrel is a special one. It is a synthetic progesterone that is devoid of androgenic and anti-estrogenic activities. Common feature of other progesterone derivatives. Okay, progesterone and anti-progesterone. We move on. Okay, progesterone may have two effects. Okay, that is anti-estrogenic and androgenic effect. Okay, and desogestrel is devoid of both of them. Okay, the clinical uses. Now we move on to uses. The uses of progestins. Okay, they are used in as contraceptive method. Okay, as an method of contraception. They can be used oral along with estrogen, or they can be used in the form of depot contraception, that is given intramuscularly every 3 months depending upon the dose. They can also be used, they can not also be, they are commonly used as hormone replacement therapy in order to counteract the dangerous effect of estrogen. And as I have already discussed in the previous video, as progesterone are given in the last 12 to 14 days of cycle. Progesterone are also used in, one was contraception. One is contraception. Okay, second point. The second point was SRT, hormone replacement therapy. Okay, the third point is dysfunctional uterine bleeding. In dysfunctional uterine bleeding. Okay. The fourth point is endometriosis. Fourth point is it is also used in endometriosis. Okay, the fifth point is in advanced metastatic endometrial carcinoma. Endometrial carcinoma, that is advanced endometrial carcinoma, it is used. Okay, and the last one is postponement of periods. Okay, if you don't want your period to be happening anytime soon, example, you may have your honeymoon coming soon, or you may have any festivals or activity that you do not want to miss due to pain, cramps of period, or maybe due to other things that bother you during your period, then you can use progesterones. Okay, for that you start 3 days before expected period and continue till the time you require it. Okay, and once you stop, the withdrawal bleeding occurs within 72 hours of drug stoppage. So postponed menses. Yes, okay, you can use progesterone and or combined hormonal contraceptive to have this feature. Okay, so these are the uses First one is as in contraceptive device, then hormone replacement therapy, in DUB, endometriosis, endo, uh, endometrial carcinoma, that is advanced metastatic, and in postponement of menses. Okay, these are the uses of progestins. Okay, so what are the side effects of progestins? Okay, now we move on to the side effects of progestins. Okay, since it has anti-estrogenic feature, it increases the LDL. Okay, increases LDL, thus increasing the cardiovascular risk. Okay, increases in LDL. So side effects number one, increase LDL, C, cardiovascular system risk. Okay, the second one is glucose intolerance. Okay, glucose intolerance to glucose intolerance. Okay, intolerance. The third one is breakthrough bleeding. The third one is breakthrough bleeding. The fourth one is androgenic. We already discussed that they have anti-estrogenic and androgenic feature. So among androgenic feature, the female may suffer from acne, from hirsutism. Okay, the fifth one is weight gain. Due to sodium and water retention, it causes edema, thus leading to weight gain. And the last one is last and important one is depression. Okay, remember that androgen, progesterone, and estrogen, they are all eliminated through the gallbladder. Thus, they have the potential to cause cholestatic jaundice, especially if you use them in very high doses. One more point about lipid profile with progestins, that newer progestins have minimal effect on lipid profile. Okay, these were the side effect of progestins. Again, depression, weight gain, androgenic features, that acne and hirsutism, breakthrough bleeding, glucose intolerance, increased cardiovascular risk by increasing LDL levels. These were the side effects. Okay, I think this is all regarding progesterone. Now we move to antiprogesterone. Okay, the progesterone antagonist is mifepristone. Okay, mifepristone. Okay, mifepristone, it is used in abortion as an abortifacient abortion. It is used along with prostaglandins to help in abortion. Okay, the other uses are in induction of labor, mostly in cases of IUFD, and the other use is cervical ripening before abortion or induction. So the uses are induction in case of IUFD cases, in IUFD, intrauterine fetal death, and the other one is cervical ripening before abortion or induction. I think this is all about progestins and antiprogestins. Again, this is an important topic. Okay, next time I think I'll discuss the difference between progesterone and estrogen.